Thank you so much. So my name is Laurent Servais. I'm professor of pediatric neuromuscular disease at the University of Oxford in the UK. That's not where my typical British accent comes from. I'm basically from Belgium, where I still work. Um, I'm super happy and excited to be here because I'm actually not a CTNNB1 doctor. I'm a muscle doctor, but I've been captured by Spila. She took me in the field to bring a little bit of my experience in building a clinical development project. So that's why I'm here. So apologize for understanding and knowing nothing about CBNN, DNNB1. My field is just about how to try to make it happen, right? So first, I got a couple of disclosure in the field of digital technology. Let me tell you why we use these little watches. It's because we want to be free of the tyranny of the single point. What do I mean? Let's imagine that these are two patients or two populations of patients, and obviously you have done something, they are diverging, right? But according to when you consider the endpoint, you could say, okay, there is no difference. But obviously the curves are diverging. So if rather than having a point assessment that you can do in the hospital or in another room, we could have the area under the curve and we could have a broad representation of what is happening in the real life of your kid, then we could be much more powerful from a statistical perspective. I was a baby myologist several years ago, and I was working in Paris for my first day at the Institute of Myology. I was so impressed by all the science there. And I was looking at a patient in a clinical trial phase 3 running a 6-minute walking test. You know, this stupid test in which we ask the kids to walk in a corridor during 6 minutes. And I was so impressed. And then the mom told me, well, he's not doing well today. I was sad. And I said, well, maybe he's on placebo, maybe the drug doesn't work. What's happening? And she told me, yes, he's not doing very well because yesterday we went to Eiffel Tower and we visited Eiffel Tower. So we were gambling decades of research, million on investment on kids who were tired because they visited Eiffel Tower. Guys, you know the point. I mean, you've been traveling from Spain, from Poland, from Mexico, from the US, from Belgium to this hub, which is Slovenia. And I'm pretty sure your kids are tired, are exhausted. You are tired, exhausted, and things that we measure can be impacted by the fact that you are just not at home, right? And we're just making a point assessment. So how could we be rid of the Eiffel Tower syndrome? Well, first possibility to go to Brussels and to conduct clinical trials in Brussels, because there is no way to be exhausted in Brussels except for beers drinking and fries. That's where you can see how different are the countries in Europe, right? The French, they have a big tower. The Belgian, they have a small man peeing. Come on. So that's why in the entire field of medicine, we used we are using more and more wearable device. Rather than paying physiotherapists and doctors, giving a wearable technology to patients. And actually, it is more and more used in medicine. So that's what I'm doing for the last 14 years of my life, but certainly not alone, with a company that is called Sysnav. And after me, a lovely engineer from Sysnav is going to explain you the practicality of that. So we've been developing over the years a device. At the beginning, it was ugly, awful, and terrible. It was called an Actimile. And then we've worked on it, and it's now, it's okay. It's what now we call a side, right? It's actually smaller than an Apple Watch. And that's the kind of signal that we can actually record. Look, this is a patient walking at home. The patient falls. The patient stands up. And the patient is able to walk again. We are able to record that at home continuously. It means that nowadays, We don't need to count the steps in the corridor. We don't need to examine the patients. We can just give a device and say, live your life. I don't care. Do whatever you want. I am able to measure every single of your strides, to identify your strides, and to measure it. So Mélissa will explain you how it goes then in the cloud, and then we analyze it and we measure every single strides. So you could say, okay, fair enough, but this is very variable, right? According to when it rains and so far and so on. And this is true. When I was in Paris, I used to develop the theorem of Servais in Paris. When the French are on strike, they walk more, obviously because of public transport that does not work. Then I moved to the UK and developed these new theorems. When it pours, British people walk less. When it simply rains, they walk more, right? So yes, obviously activity is social dependent, weather dependent. But let's imagine this is the activity of a kid. And parents are divorced. So during the week, is with mom, and she's a sport lady. She runs and she makes sports. And then he goes to the cousins, the father's side, the mother's side, and they walk in the countryside. And then he goes to the father, and then the father is interested by barbecuing and TV watching. And then he goes to the cousins, the father's side, right? And then they just look at the Euro Cup of football. And I think that Belgium will win, by the way. Variability is huge. I agree. But if we average on a 3 days period, the variability decrease. If we average on a 7 or 9 days period, the variability decrease. So the longer is the period on which we average, the lower will be the variability. Well, it's not a joke. I mean, we could get approved by European Medical Agency, first as a secondary endpoint in Duchenne muscular dystrophy, then as a primary endpoint. And it is the very first time that a regulatory agency qualified a primary endpoint that is a digital outcome. That is something that we can do entirely remotely. So to accelerate things, we developed 2 protocols, and they are umbrella protocol, ActiMocap and ActiLiège. And 5 kids with CTNNB1 mutations came to Liège in the ActiMocap, because the first thing we want to do is to be sure that when we measure a stride in a patient, we measure a step, this is actually a real step, and that we are able to measure the step, right? So this was a control environment study, and we could confirm on these 5 patients that indeed we can capture every step of a patient with a CTNNB1 mutation, and we can indeed measure this step. So this was in Liège, Belgium. So now we are ready to move in the real life, and 20 of you will participate in the study, those with kids who are ambulant, so that we can now check in the real life outside the lab if we can measure it. And I'm going now to give the floor to Mélissa, and I just want to finish by thanking my teams. This is my lovely team in Liège, and this is my PhD student. She makes all the work. I speak and she works. And this is the lovely team of Sysnav. Especially, I want to give the credit to Melanie, who was a fantastic, amazing person, dedicated to patients and to a person with rare disease, and she died, unfortunately, last year. She developed a lot of work, but I know that her energy is with us today. So with that, I give the floor to Mélissa. Thank you so much.
Hi, everyone. There is no slide. Just the slide.
I think it's the same
Not working.
presentation.
This is the problem with
okay.
engineers.
Yeah.
There you are. And that's for pointer. So to move on.
Yeah.
Go back.
Okay, perfect. Thanks. Hi, everyone. So I am Mélissa Menard from Sysnav company. I am study manager. So I will be the main point of contact for this study. And I will just talk about the technical part of the device in the study. So as Laurent explained it, so the side device is just one station with 2 sensors, and both sensors will be worn on each ankle for the patient, for the ambulant patient. And in the suitcase, so there are the station, the devices, the sensors, the power cable and the Ethernet cable. And the Ethernet cable will allow us to recover the data on a daily basis. So that means that we can check the data on daily way. So on the device, there are 3 LEDs for the just to know the charge part of the sensors and to be sure that the data has been uploaded. So there are 3 LEDs on the station and 1 little LED on the side of the sensors to be sure that the device has enough charge and to be sure that the sensor is recording. So on a daily use, in the morning, so this is just a typical day of a child wearing the side device. So in the morning, the 3 LEDs on the station should be solid green, and the patient would just put the sensors on each angles. And the little, as I say, LED on the side of the sensors, it's blinking in white. During the day, the patient will record as much as possible to record the data, and as Laurent explained it, during his activity at school, during sport, anything. And during the evening, when the patient will go to the bed, he will just put back the sensors on the station and the little LED will start blinking green. And during the night, sensor will be charged and data will be uploaded. Regarding the positioning in this study, so patient will wear the sensors on each ankle, on the right and on the left. And there is little stickers to determine which one will be on the left and which one will be on the ankle. This is very important to keep the same positioning during the whole study, to not reverse the sensors. And the sensor will be just worn just above the lateral malleolus on each ankle. Another thing very important is the sensors are not waterproof, so they have to remove the sensors for any kind of water activity and also for specific medical exam as MRI or CT scan. And just they remove it, they put it on a flat surface because if the patient, if the parents put it in their pockets, that will record the activity of the parents. So just on a flat surface, immobiles that would record inactivity, this is not an issue. And after, they can rewear the sensors and start again the recordings. Regarding the protocols, so they will start the recordings after this conference. So for 30 days, they will start to record. And after the 30 days, we will recover the data, give the family some feedbacks. And they will have another recording period here at month 12, 1 year after, of 30 days as well, just to know to see the evolution between the first recording period and the second one. So this is to see the evolution of the disease. There is only one thing, is that the sensors need to be charged every 6 months. So I would just send a little reminder to the parents to connect the station and to recharge the sensors. And for patients without internet connection, so there is a little USB drive in the station. So all data will be stored in the station and we will recover the station just after the first recording period. And at the end of the study, we recover the device. I will be the main point of contact for this study. If the family has any questions, so there are the patient documentation in the suitcase. I will organize some training session today and tomorrow and we will equip the patient with the sensors. And this is my email address to contact me if there is any question. And you can also contact the investigating team if needed. Thank you so much for your attention, and I will be pleased to answer your question if you have any.